Virtual colonoscopy, should it supplant the real thing?
Endoscopy is a non-surgical medical procedure that allows a doctor to examine the inside of the body using an endoscope, which provides a direct view of internal organs. And for the focus of this presentation, we'll be looking at colonoscopy, which is the examination of the large intestine.
Let's move on and have a look into what the process of conventional colonoscopy involves. Firstly, the patient is given a pain reliever and a sedative intravenously, so they are relaxed and slightly drowsy. The patient is asked to lay on their left side with their knees drawn up towards their chest, and a small amount of air is used to expand the colon. Next, a long flexible tube with a camera attached to one end known as a colonoscope is inserted into the patient's anus and navigates its way into the rectum and colon. The camera continuously scans the lining of the colon walls to examine for any abnormal tissues such as polyps. This whole process usually takes around 30 minutes to an hour, and in most cases allows for accurate diagnosis and treatment of colorectal problems without the need for more invasive procedures. Now let's compare conventional colonoscopy to virtual colonoscopy. Virtual colonoscopy, also known as computerized tomographic colonography, is a procedure that uses an advanced digitalized software and CT scan imaging to produce a series of images, providing a minimally invasive evaluation of the colon without the need for the patient to be sedated. During the procedure, a small tube to the size of a pen is inserted only a short distance into the anus to allow for the distension of the colon with air or carbon dioxide. Cross-sectional images are then generated during the CT scan, and over 1,000 images can be produced in a single scan, containing both two-dimensional and three-dimensional forms of the colonic mucosa. After this is completed, the images can be viewed on a computer screen, where radiologists can navigate their way through the entire colon based off the following images and thus examine and make a diagnosis. So what's the purpose for all of this? Did you know that colon cancer is the second leading cause of cancer-related deaths within Australia? Evidently, there is a growing need for effective screening procedures. The importance of virtual colonoscopy can be defined in two words: detection and prevention. Virtual colonoscopy is a diagnostic and screening tool used for people suffering or at risk of colon cancer, allowing radiologists to identify polyps, which is an abnormal growth that arises from the inner lining of the intestine, where a substantial growth can consequently lead to cancer. Overall, this method helps increase screening rates as people are more accepting of this procedure, therefore aiding in the management and prevention process. Now let's continue exploring the significance of virtual colonoscopy by looking at the pros and cons. Let's start with the pros. Firstly, despite having to insert a tube into the rectum, virtual colonoscopy still provides a less invasive process compared to regular colonoscopy. The procedure takes less time, roughly 10 minutes. It's safe, more affordable, and doesn't require sedation, resulting in little to no recovery time. Another advantage is that you can see the entire colon. There may be some instances during regular colonoscopy where the colonoscopist can't maneuver the scope around the entire colon. However, this is not the case with virtual colonoscopy, as it is basically a CAT scan and the entire colon is always visible. The scan also covers other organs within the immediate vicinity, which allows the diagnosis of conditions outside the colon as well. But despite the benefits that constitute virtual colonoscopy, the inherent apprehension associated with the procedure surround the inconvenience of the prerequisite preparations. Let's look at the cons. A large portion of the disadvantages is related to the consumption of bowel cleansing agents that predispose patients to the resulting diarrhea. Coupled with this is the radiation exposure involved in the procedure. And one other thing, if a polyp is detected, then regular colonoscopy is required to remove the polyp. The images that can be seen is a comparison of the view of a 1.2 centimeter polyp detected on virtual colonoscopy and conventional colonoscopy images. A conclusion of whether virtual colonoscopy should supplant the real thing will be determined on the accuracy of virtual colonography results from a vast number of participants assessed over multiple screening centers. The sensitivity and specificity of both virtual colonoscopy and conventional colonoscopy was measured based on how accurately either techniques were successful in identifying lesions at a minimum size of 6 mm, secondary outcomes detecting all lesions and advanced lesions, the subject or patient's preferences. In a study conducted by Cotton and others in 2004, results show that virtual colonoscopy failed to detect 2 out of 8 cancers, with sensitivity and specificity results continuing to decrease as the study progressed when compared to conventional colonoscopy. Despite patients' preference of disliking both procedures, conventional and virtual colonoscopy, Cotton suggested that virtual colonoscopy is still a relatively new technology and that methods are not complete for widespread clinical use, with techniques and training as a compulsory requirement for this technology. Therefore, it can be concluded that virtual colonoscopy can't supplant the real thing at this point of time.